Okay, alright, good evening everyone. It's Friday, 6:20. Okay, we have a surgery today. After clinic hours, we got Ina. This patient is no other than our very own dog. This is Ina, 11-year-old. Intact, sorry, neuter, spayed. She's already spayed, female toy poodle. Okay, I'll just would like to share the history of this dog. This dog is one of my oldest dog. Okay, after Kobe, before I got a big dog, a Labrador Retriever, and Kobe was euthanized as per our decision because he developed a oral tumor. But it was malignant tumor. So we tried several surgeries on Kobe, but we failed because the tumor is going back, and we don't have any option but to put him down because we're so afraid of the pain and discomfort on Kobe's condition. Then we have now Ina, tama? 11-year-old na si Ina, and Ina has so many surgeries since we got here. The first time, the first surgery Ina undergone was on his on here, right foreleg. That time I was not performing a surgery or orthopedic procedure. It was around 2014 when he accidentally fractured here right forearm. So the fracture was on the most distal radius and ulna. So it is almost near the joint on the carpus, metacarpal joint. So I tried my best to fix the fracture, and I don't have any enough experience at the time, and I was trying to perform the surgery because that's the only thing I can do. So I use human grade implants, and it's a bit larger than compared to Ina's smaller bone. So the surgery doesn't went well, and it's failed. And I tried another procedure. It failed again, and that's the time I was challenged. I was frustrated and challenged, and maybe that was one of the reasons why I pursue reviewing and studying and develop my ability to perform surgery, or my skill to perform orthopedic procedure. As we all know, here in the Philippines, we don't have specialty for orthopedic surgery, unlike in other developed countries. Okay, all veterinarians are considered general practitioners. Okay, so I myself, I cannot consider myself a surgeon because I don't have the certification that will give me that title as a surgeon. But I can do ortho and other soft tissue surgery. And then Ina, the first surgery was on the right forearm, the fracture on the distal radius and ulna. But 2 or 3, maybe 3 attempts, all were failed. So what happened to Ina's arm was that it develops a non-union fracture. So a non-union fracture the bone will start to shrink to to what we call this. If there is atrophy in the muscle, there's also atrophy in the bone because there is non-union fracture. The two segments, the two fragment, major fragment, doesn't have a blood supply. The blood supply was cut and it develops hypoplasia and it gets shorter and shorter and shorter when compared to the normal left radius and all that. So Ina was using only 3 leagues at the time since 2014, no? 3 leagues lang siya kasi ito flappy, non-union fracture. Then after several years, because we feel that Ina has not is not comfortable with the 3 league and with the right forearm is still there while it's not useful and useless. So we decided it to be amputated via scapulectomy. Okay, so Ina only has 3 legs now. Yeah. But before that, Ina also developed a bilateral what we call this bilateral medial patellar luxation. So Ina undergone another series of surgery to repair the patellar luxation. So bilateral. Then after that, Ina also suffered from hip dysplasia on the right hip. So that time we tried using a toggle pin method. So what is toggle pin is that we don't cut, unlike episo or femoral head osteotomy, we save the hip, but we place some implant there together with a titanium button and a toggle pin and also a fiber implant to connect and to secure the hip back to its socket, no, the ball and socket joint. But we noticed that the toggle pin method didn't it serves as a temporary relief and prevent the further development of high-grade hip dysplasia. But yesterday we took an X-ray because of the limping, lameness that we noticed on Ina, and we observed that nagkaroon na siya ng tinatawag na osteoarthritis doon sa kanyang right hip joint. Maybe because of the previous injury na we fixed it or we tried to save by toggle pin method. But the toggle pin didn't work. I think it works in a while, but later on it failed to prevent the development of complication with this osteoarthritis. So Ina is in pain and is not able to walk with the right rear leg. So ngayon nahihirapan na siya tumayo kasi tatlo na nga lang yung paa niya, then nagkaroon pa ng another problem doon sa kanyang right hip. So meron na siyang previous surgery doon sa kanyang right hip joint, yung toggle pin method. Then that was not the procedure that we did on Ina. Last February, so mga 4 months ago, nagkaroon din siya ng pyometra. Okay. Pyometra, we noticed Ina was very ill and very sick and mahina, matamlay, ayaw kumain. yung pala mayroon siyang pyometra. The reason why we did not spay Ina before is that naawa na kami dahil marami na siyang surgery na dinaanan, no? From the foreleg, no, the right foreleg, then three times namin deny effects but we fell, then in-amputate, then nagkaroon na siya ng bilateral patellar luxation, nagkaroon pa ng hip surgery for the toggle pin, then na-amputate pa yung kanyang right foreleg. So although I recommend spaying, I discussed to my family, but ayaw ng mga bata dahil naawa sila. So nag-develop siya ng pyometra. Then fortunately we saved Ina from the infection, possible infection and sepsis nung caused by pyometra. So nag-perform kami ng spay pyometra. Then 2 days ago, ito na naman siya. Was limping, was not moving and not able to walk, to stand, because tatlo na ng paa niya, plus nag-develop na ng osteoarthritis yung kanyang right hip. Now we're going to to perform a FHO, kasi yan lang naman ang pwedeng gawin natin for patient like Ina. Ito si Ina ngayon, my dog. It is our very own dog. It's ready for surgery. No? Na-prep na siya. Then it's a very common procedure. Yesterday, meron din kaming patient na nag-undergo ng FHO. As I've repeatedly mentioning here in some of my posts and videos, na mas routine pa namin ginagawa ngayon ang mga FHO and other orthopedic procedure kaysa spay and neuter. Okay, so this time it's my dog na kailangan ng FHO. Makikita natin dito yung kanyang previous surgery. Ayan, mayroon pa siyang scar dito sa kanyang right hip joint. Hip dito sa kanyang thigh area, lateral thigh, kung saan nag-perform kami ng toggle pin. Okay? So, ang importante ma-prevent natin dito yung atrophy of the muscle. Okay? So, yun. And of that, makatulong ulit sa mga pet owners na katulad namin, no? Ang hirap lang kasi magkaroon ng isang dog, na sarili mong dog, kahit kami ang gagawa, pero ang hirap na mayroon kang nakikitang sarili mong aso na nahihirapan o nasasaktan dahil sa ganitong mga conditions. So, Ina is fortunate kasi nandito kami to save here, and we'll try our best na ma-correct natin yung problem before magkaroon ng complication. Okay? So, this is I hope na Ina's history or Ina's story can be a source of additional information for other pet owners na walang pinipili ang mga ganitong diseases, no? Either regardless kung owner man niya i-vet ay o hindi, talagang dogs are predisposed sa ganitong mga condition, no? Hip dysplasia, no? Okay. So, isa rin dito yung mga diseases like na na-mention ko, yung mga patellar luxations, no? Kasi hereditary po yan, hindi natin yan mape-prevent or may iwasan dahil kusa siyang magde-develop, no? Then yung pag mga ganitong breed of dogs like toy poodle, masyadong maliit ang kanilang bone structure compared doon sa ibang breeds of dog. So, ano din sila, high risk sila sa fracture. Okay? Then, that's all, and we'll stop the live stream kasi marami naman tayong mga live stream na ng FHO, so hindi na kailangan natin i-continue. Okay. Thank you guys for watching. We'll start, and we are still preparing for the surgery.